think is the most difficult misperception that you are dealing with right now?
Yeah, I'll lead. I think it's the cruelty of exponential math, right? So this comes up from friends of mine who are in places, fortunately, that haven't had big outbreaks, haven't had a lot of deaths, and they don't understand why they have to be shut down. And we think of the pain of small business owners and people who have lost their jobs, and they're asking very understandable questions around, why has my livelihood been shut down when my community's fine? And I think part of it is that exponential math sucks. It is cruel, right? So while their communities are doing okay now, one case turning into community spread can lead to the next New York City. And it's a hard thing, right, to weigh a risk that's exponential in the near term as opposed to something like a lost paycheck that hurts you right now.
And there was actually a related question to that. Somebody asked, what's the rationale for not traveling to your vacation home within the state? And I think that's the rationale, is that, you could be carrying that one case to a rural, especially in Wisconsin, to a rural place that has essentially no capacity to handle a COVID-19 hotspot, and also has a very high number of older people who are at higher risk from complications. So that answers another question too. So let's see, Jen, do you want to say what's your most difficult misperception?
I would say, yeah, along those lines, that there's a really kind of no-sum game between public health and economics here, which I think most economists that you talk to have a lot of the same concerns about opening up before test and tracing and things are available, because if it is let loose and we get hotspots similar to New York City all over the place, that's way worse. Well, that's terrible for the economy as well. So I think there's not a strict dichotomy between the economy and public health, and everyone wants the same things to kind of open up safely and strategically. And so I think we shouldn't start pitting ourselves disciplines against each other. We can accomplish both goals. And we're all aware as social epidemiologists of the importance of, the economy and jobs and security for broader health. So we're all concerned about that. But then maybe—
And Jen, can I amplify that point just real quick? So I am a public health professor in a business school, and I have not one trace of cognitive dissonance. She's right. Jen is right. I mean, I think smart business people and economists know we have to stamp this out now.
Yeah, absolutely. And I'll just throw another one out there that maybe other people want to chime in, but because I've studied this also, sort of the age pattern of mortality is really concentrated at older ages, especially in Italy and Spain. But I think in the US, we're seeing, a slightly younger age profile of mortality and serious hospitalizations and complications. And so I just want people to realize that it's, we can't say it's just this other vulnerable population that's not gonna, come into my household. That, first of all, we all know plenty of people and loved ones over age 65, but, it is striking younger people, luckily not as many kids, which I think is one really lucky feature of this particular infection. But the US, obesity is a risk factor, hypertension, there's lots of underlying conditions that can make people vulnerable to complications. So we shouldn't feel just like it's only affecting this small group of vulnerable people. We all need to be careful.
Amanda, how about you? What's your most difficult misperception?
I think the sort of misconception that once we flatten the curve, we were done, right? That was the first step, right? And a totally necessary, urgent tactic for us all to take because of the need to ramp up these other tools that we can use to sort of maintain containment of the outbreak over time. And so, we're seeing pushback now that curves are in the flatter stage in many areas. But as I said, we need to actually have that curve descend over time to feel like we're in a place to utilize other tools that we have. So I think there's been a lot of disappointment, like, oh, stay-at-home orders just got extended, and I think just trying to clarify that, this is sort of the purpose of what we're doing right now, is to step back and say, okay, we need to protect people, protect our healthcare capacity and plan. And so it may, take longer. I was saying to someone, it's really been 3 weeks in Wisconsin. And I think about all the decisions that have had to be made by public health professionals during that time, between going from 2 state labs that were doing testing to now 23 labs that are on board doing testing, securing and taking inventory of PPE across the state, identifying alternative care facilities in case we need them. I mean, so much has happened in 3 weeks that I think the people, people who are just know that they have to stay home, or they're losing income, or their children are home. It's hard to know what all that is happening behind the scenes, and why this pause is necessary, and why it has to continue in some locations so that we can keep that planning process moving forward.
I agree. It's been probably the longest 3 weeks of my life, and I can only imagine how long it has been for people who are working in the state labs and the Department of Public Health and other decision-making roles. It's been a rapidly changing environment. This is one of the things when people ask me, are summer camps going to open? I'm like, I could never have predicted where we are today 2 weeks ago. So I have no idea what to tell you about summer camp. Yeah, I think I'll just answer. I'll answer that briefly. For me, the hardest misperception is surrounding what are the models telling us, and what even are models, and why have they been wrong in some places. And I think most people don't deal with models, predictive models in general, except for the weather forecast. And in this case, we're all trying to make models using very, very scarce data. And so if it feels like they're wrong, it's because we know very little. We're doing our best to figure out what's going on with very scarce data. And this is one of the other reasons that we really are advocating more testing. So I'll just wrap on that point.